Hello, everybody. Thank you so much for joining us. It's really an opportunity, and we are so glad and happy to host this event on behalf of Settlement Support CIC. My name is Annabella Wusu, and I will be your moderator for today's event. Today, we are going to hold the health event. I'll quickly talk about Settlement Support CIC and what we stand for, what our aim is, and what we pride ourselves for. So Settlement Support, we pride ourselves to facilitate the integration of people from the Black community, Black and BAME community in the UK, facilitating their integration in all aspects. So going from educational aspect into the employment, but also within the health aspect, as we are going to hold today. So without wasting much time, I would want to introduce Mr. Olu, who is going to take us through the event for today. Prior to that, I would like to really thank the Board of Settlement Support for giving us this opportunity to host such an event, which I believe is going to really enrich all of us. And yeah, that's it. Thank you so much. So, Olu, to you.
Okay, thank you very much. My name is Olutosin Awoyemi. I'm one of the I'm a GP in the NHS. I have been working in the UK for the past probably 8 years, and I'm very I'm honored to be invited to speak on this presentation, on this webinar. So today I'll be speaking on your health and the NHS, what every minority must know concerning their health in the United Kingdom. It is quite a broad topic, and I will just be going on. I would like to come from the as a way of introduction, really. I would like to come from the background of what the charity the foundation is about, which is settlements. And I would like to say that why are people settling in different countries? What are the different reasons for people to settle in, for example, the UK or any other country that they will be settling in? So just by way of my own initial thoughts is what's the reason for leaving one's home country, and what is the reason for settling in another country? These are some that I have been able to put together. Some people would like to experience more of life. Some people would like to be better financially. Some people would argue that the reason why they are settling in another country is to give their children a better life than what they had. Some people want to be fulfilled, and some people are running away from wars and hardship. Do we have any other reasons? Just to be interactive a bit before I continue. Does anybody have any reasons for settlements? Just
education.
For education, yes, that's a good one, for education. And so different reasons. But when I've gone through all these reasons one by one, I found out that what is the main why of settling in a different country. And the main why of all the reasons that could be mentioned could be summarized to this: to improve our health and well-being and that of our families, mentally and physically. Kind of. That's like the general stream of why we want to leave my own country and settle. So to improve our health and well-being. If you look at all those reasons, it centers around there. So I'm basing this presentation today that the true green pasture, the true green pasture is where our health is preserved, isn't it? It's where our health is preserved. And many people forget about this and they do themselves disservice. And when they settle in a different country, they are busy working so much and they miss out on the main reason why they have left their country, which is their health. So I'm doing all these extra shifts, I'm doing all this work, I'm doing so many things in this new country, and I have neglected my health. And when you peel down the layers, you find out that my health in the first place is the reason for settling. If we understand, do we understand what I mean? So we do ourselves the service when we neglect it. So when it's about settling, we also want to make sure that our health is a priority. Because when you lose your health, you lose all the education, being fulfilled, being there for the children, all that becomes all secondary priorities. So our health is priority and we should think about it. Also, another good thing about this is choosing the country to settle in. And I want to say a big welcome to the UK because it's a very, very, very good place to settle in terms of health. And that's why I'll be introducing you to what the NHS is. It's arguably the most efficient, one of the most efficient health systems in the world. Some people don't want to agree with that, but really it is. And I'm actually very proud to be associated with the NHS. It was founded in 1948 after the Second World War. Now, after the Second World War, there was an ethos, and the NHS was birthed, and that health belongs to the people. That it's a fundamental human right, and people should not be denied access to health because of inequalities. And this is the main ethos of the NHS. It is there to improve our health and well-being, supporting us to keep mentally, physically well, to get better when we are ill, and when we cannot fully recover, to stay as well as we can to the end of our lives. It works at the limits of science, bringing the highest level of human knowledge and skills to save lives and improve people. These are the principles of the NHS. It's available to all. It's available to all. I did a master's. I had a master's degree in public health in Finland, and we actually went into all the health systems that we have. We had an American student, one of my classmates, and she was telling me that in America, because of what she earns, her own income bracket, she dares not go to the hospital. In fact, there was a day she had a fracture. She did not go to the hospital. She just binded herself and continued life. Why? Because it's expensive, or you have to have very important health insurance, and that is against the backdrop of the UK, where comprehensive service available to all, and it is based on clinical lead. It's not based on your ability to pay. So it's practically free. Well, nothing is free in this world because it goes in taxes. But even in other countries where they have to pay out of pocket, they also pay their taxes. So it provides the highest standard of professionalism. Doctors go through a lot of grillings, and staffs actually go through a lot of grillings to provide healthcare. I just want to take you through this. What are the barriers? Hello? Okay. What are the barriers to health service? Now, this is a general thing. What are the barriers to health services? The barriers to health services, why people do not access health. These are the main things in public health. Number one, the location to health service. That is, I can remember back in Nigeria, some people are living in the villages. The next hospital will be hours and hours away. So location and actually being able to afford it. Sometimes back in Nigeria, even when you even get to the hospital, there are no available staffs or resources there. And the last thing is the attitude. Now, I just want to say about all this. The NHS actually reduces all these barriers to a barest minimum. For example, Australia and Canada, they also have very good health systems, even though they have to, very good health systems. But there's something about the location of the health systems. Before you can get to a nearest hospital, it's far. Do you get what I'm saying? The NHS has been derived in such a way that it reduces the location. It makes it affordable because you don't need to pay out of pocket. Now, the main thing that we need to actually educate ourselves about is our attitude towards the NHS. Do you actually go and seek? Do you actually use it? Because if you don't use it, then you cannot get the benefits of it. It reminds me of a story that someone once told me about a man who saved a lot of money because he was traveling by air. This was the first time he ever traveled. So let's just say he was traveling from Nigeria and he was traveling to Australia. So he has saved all the money he could ever have and bought a ticket for the flight. And when he bought the ticket for the flight, when he bought the ticket for a flight, that was all his money. So he got on the flight, and the air hostess was coming and giving food to everybody. Because that's the first time he has ever flown, he thought that if he collects the food, he has to pay, and he doesn't have money. So what he did was that each time they brought the food, he would say no. They will bring drink, he will say no. He was very, very hungry, very, very hungry, but he could not just take the food because he was too hungry. Now, this man went into 3 flights, almost 2 days journey, without eating, not knowing that the food has already been paid for. Now, the attitude sometimes would not know what we have available. That is why some people might suffer in silence. And when you are in the UK, resident in the UK, you have availability to the NHS, and you should know and you should use it. Okay? Who can access the NHS? Who can access the NHS? Now, the NHS can be accessed by any resident. So, resident means any citizen of the UK, one, and anybody that has an indefinite leave to remain. Anybody that has you can access the NHS. The NHS is a big umbrella. It's a multi-billion, or I would say trillion, giant umbrella which serves health services and makes sure that its citizens are well. Okay, work visa, anybody or student visa, anybody that is staying in the country for more than 6 months. In 2015, this health surcharge was introduced. 2015. So before 2015, there was no health surcharge, but now health surcharge, I think, is about £120 per year or something like that. So health surcharge is now being charged if you are applying for a visa, a work visa, or a student visa. It's still a very, very small, even though it's significant, but it's still a very, very small pay for what is available on the NHS. So if people are coming in as visitors, they can also access the NHS, but they are limited to only emergencies. So for example, if they fall ill and they go to A&E, they are not going to be charged. They can use it freely. Also, contraception is free. Contraception, that is to birth prevention pills, is free for even visitors who are on visitor visas. Asylum seekers have access to full NHS, whether emergency or outpatients. How do I need to register? The GP is the point of the entry into the NHS. GP is and you have GP within 1 mile. Most times around the country, within 1 to 2 miles, you would have a GP surgery. That is the model, and you can always access the NHS that way. What do I need to register? All you need is a valid ID passport and a UK utility bill. That is anything that would show your proof of address. That's all you need, and you go to your own choice of GP. Look online and just type GP near me, and go with these two things, and you can be registered with a GP and have access to the NHS. What are the services available? The services are so numerous. Women healthcare. So we've been access to gynecological services, sexual health services, maternity care. If anybody's going to have a child in America, they pay through their noses. They can pay through their nose, unless you have good insurance. In the UK, no matter the service you have, if you have surgery, if your child was put in intensive care, everything is free. You have availability, and actually you have availability for IVF treatments for people below 40. There's a lot of criteria surrounding that, and screening programs. You have mental health care, counseling, medications, reviews. You have dentists on services, but those ones are classed as pay. I think that's one of the only services in the UK where you have to actually pay out of pocket. Then you have the NHS health check, which I'll be talking about very soon. Very, very important NHS health check. And then screenings of so many sorts. We'll get into that also. Okay, now I would like to talk about the NHS healthcare because it is the fundamental. It is so important, and you know it's so important. And I found out that many people of the minority culture, or the minorities, I'm saying blacks and people that are just coming into the country, settlements, they do not do this stuff called the NHS healthcare. Health check. Sorry, it's not healthcare, it's health check. Sorry. Let me see whether I got it. Yes. So it's NHS healthcare, not health check. So it's a program that is put in place to spot early signs of things that can cause stroke, kidney disease, heart disease, irregular heart, high cholesterol, and heart failure. Now, when I was working as a doctor in Nigeria, I found out that many patients that we treat, for example, diabetes, many of them already have problems. Probably some of them are losing their legs. Some of them are blind. Some of them already have kidney problems, swellings in their legs. The reason I found out was because we do not have a structured primary care system that can spot these things early enough. So the only time people come to the hospital is after they have had complications. I know so many people that will be going around and say they are healthy, but what they are actually saying is that they don't yet have complications of certain health problems. Now, there is no point waiting for when one has a complication before finding out a problem. The most important thing is to find out the problem before the complications. Which now brings me to the NHS health check. From the age of 40 to 74, it's important that everybody in the UK gets a NHS health check, which is simply you go or these days you get a telephone call where you would go through your health status, and then you get a blood test which will check a number of things like your cholesterol, your blood count, your nutrient levels, different things. And then we run a calculation based on this and see your health check, your health your health status. And this can actually peak especially diabetes. That's what I have noticed, especially in this country. We pick diabetes very early. And because we pick, and blood pressure, those two, diabetes and blood pressure, because we pick it very early, it is easier to manage and people live longer with these conditions. Albeit in other countries where they don't have a good primary health care, they pick it late. So why is the government funding all this? The government is smart because the cost of treating people with complications is so much that it is easier to treat them when they don't have complications. So in a way, the way the NHS is run is in such a way that it actually saves cost, even though we are giving health service to many people, a lot of people. So it is important that people who are minorities, who do not know these things, make sure that they get their NHS health check. It happens about and you should have it at least every 5 years. That is, if in the first time you did it, there was nothing that was noted that was a problem. Okay? Every 5 years. Now, screenings. This is one thing that the NHS is very good at. Very, very good at. The NHS is good at, so if you look at it compared to a lot of other countries, they are good on their screenings. Now, we have diabetic eye screening. When I was working in Nigeria, we had so many people who just go blind. Now, the commonest cause of blindness is age-related, so you grow old. But when people are getting younger, one of the common causes of blindness is diabetes. And if people are diabetic and they are getting screened yearly, it's an annual screen, they can easily pick out when they need laser treatment and their eyes will be preserved for a longer time. Next screening, which is very, very important, is the cervical screening. Many minorities, as a GP, I manage thousands and thousands of patients, and I can see a pattern that a lot of minority people, women, do not come for cervical screening. What is cervical screening? Let me not just assume that you know what cervical screening is. The cervix is the neck of the womb, and on the neck of the womb, a cancer can start to grow there, and it's a very, very deadly cancer because it tends to spread very fast. Now, about 9 people in the UK, about 9 people will get cervical cancer every day. Listen to that. It's not every year, every day. Like today, 9 people probably would have just developed cervical cancer. Tomorrow, another 9. Next tomorrow, another 9. Now, look at this. It is very preventable. 99% of cervical cancer is actually preventable. In the world, cervical cancer is the 4th commonest. But look at what we have done in the UK. It is now down to the 15th commonest in the UK. But in the world as a whole, it is the 4th commonest. Why? Because of the cervical screening. Now, the cervical screening is situated at from 25 years old. From when you are from 25 years old to 64, you have a cervical screening every 3 years till you are 64. Make sure all the women that are listening, please encourage others to always have their cervical screening. Once they are 25, they automatically get a letter. But because people are coming in and they are settling, they are not in this country for a long time, they get missed out. So ask your GP to see how you can get on that system to always get your cervical screening. Breast screening, very important. Breast cancer is the one other thing is about vaccination, because cervical cancer, 99% have been noted to be caused by a bug, sexually transmitted bug called HPV. And now there is immunization for cervical cancer, which is quite good. They started vaccination in 2008. So for people about 12 to 13 years old. So people that started this now are now about 25 to 26 years old. So in the next 20 years, we will see what, if possible, cervical cancer can be eradicated or yes, yeah. Okay, so breast cancer is probably one of the most common, is a commonest cause of cancer in women. Imagine 155 women every day develop breast cancer. Just imagine, yesterday 155 people developed breast cancer. Today it's already 310. Tomorrow 450. That is how much, that's the severity of how people develop breast cancer. And the point is that it is very preventable, because it's just about touching your breast and knowing whether you have a lump or not and getting that checked. Breast screening is offered from the age of 50 to 70, which you do a mammogram, which is just like an x-ray of your breasts. Very non-invasive, not painful, but it is, you have to know and you have to be sure that you're actually getting it. You are 50 years old, try and start asking what whether I'm going to get a screening or not. If you don't get an invitation, you can just go on this website, w.nhs.uk screening/breast screening mammography. You can book it yourself. Okay, and there's this and after the and if you have a first degree relative, what I mean by that, okay, I think I have to start rounding up now. Yes, if you have a first degree relative like your mom or your sister who had breast cancer, you are highly likely, you have a higher rate of developing breast cancer. So you should probably even be getting a mammogram earlier. There's something called the Angelina Jolie effect. I don't know whether anybody would have heard about that. Angelina Jolie's mom passed away with breast cancer, and I think one of our first degree relatives, I'm not too sure. There is a gene when you have close relatives that have breast cancer called the BRCA1 gene. And Angelina Jolie decided to remove her breasts. So she doesn't have breast cancer, but because her mom had, and she had the gene for developing a breast cancer, she just decided to remove both breasts, even though she doesn't have cancer, and at least she will not have any ideas that breast cancer is going to come again. That's the Angelina Jolie effect. There is a website called Know Your Lemons. Know Your Lemons. A very good website you can actually have a look at. It teaches you about how to check your own breast, and this is like a pictorial diagram of what breast cancers look like, feeling for, and what you should be doing. If you feel any lumps, do not second guess and say maybe not. If it's not disappearing with your cycles, speak to your GP. Very important. 155 people are developing breast cancer every day. 155 people are developing breast cancer every day. Don't be one of them. Bowel cancer is the fourth most common cancer. Fourth most common cancer. 120 people are developing bowel cancers every day. Thinking back at my country where I originate from, Nigeria, I've been hearing about a lot of people who have been dying. My parents' kind of age, and I've seen that most of them is bowel cancer, bowel cancer, bowel cancer, bowel cancer. In this country, from the age of 50, you get screened, and you must make sure that you are actually doing this. From the age of 50, there's something called a fit test. You are invited to have a test like this, and then you have it every 2 years till you are 75. Many of the people that I've heard that died in my own country would have probably been and diagnosed earlier and not die at the age where they died. Everybody will die at some point, so it's not really like they will live forever, but at least that would have been their lifespan would have been extended if they had a screening this thing in place. The next one is the AAA, that's abdominal aortic aneurysm. There is in the stomach, there's one big artery that supplies the rest of the body from the heart. It gets bigger with time, and in men, it is known that it usually gets big and sometimes it just ruptures suddenly. Sometimes in Nigeria, some people die and they just go down, boom, and we say, it's probably some evil spirits or some evil spirits are involved. But really, sometimes it might just be that artery has just busted and then they die. But yeah, from 65 years old, everybody is probably screened for abdominal aortic aneurysm, which is quite good. The next one, which I'll be stopping with, is the prostate screening. The prostate screening. So it is one of the, I think, second most common in men. Prostate cancer. There are different types. Many of them are not aggressive and would just have a cancer and you don't need to do anything much about it. But prostate cancer can easily spread, and that's why. But there is no fundamental screening for prostate cancer. However, it's on an ask-only basis. If you don't ask, you won't get screened. So starting from about 50 years old or thereabout, it's probably best to speak to your GP, especially if you have family history of people having prostate cancer. It's probably very good to speak to your GP, and an examination and just a simple blood test could be done. So I'll just be stopping there and just summarize on the basis of the fact that the reason why people settle or come into a different country, there are so many reasons, but the main reason is to improve our health and well-being, and that our families be mentally and physically well. That is the main thing. And if that's the reason, it means that the reason for settlement is where our health is preserved. Many people forget this, work all their lives, do extra shifts, shift on shift, and they forget their health. And now that we know that health is the most important thing for settlement, what is available? And I've introduced you to NHS. It is a very, very comprehensive, good health system, and it helps so that if you can't afford it, you can still be seen. And I've told you how you can access the NHS and the screening and health checks that are available. Thank you very much.
Thank you so much for sharing this very useful information with us. I can say it has been really, really enlightening to know about all the different types of cancers and how they can actually affect us as migrants within the UK. And this is all settlement support aims to do, to provide awareness for us to be able to best make use of the facilities that are at our disposal, because most of us are not aware of what our rights are and what we are entitled to as people or migrants who are settled in the UK. I felt it was very, very insightful to have the statistics and data about women who are, maybe because I'm a woman, who are diagnosed with cervical cancer on a daily basis, and much more with regards to breast cancer. I wouldn't have really thought the numbers were so high. So clearly, if the NHS is putting such a service at our disposal to be screened and checked in order to prevent and catch these diseases on time, I think is something that we shouldn't really hesitate to make use of. And also that goes for the men as well. At this point, I would like to take some questions. If there's any questions for our GP here with regards to anything within the NHS or, you know. Well, I'll start, GP. So my question is, when is it that we go to the A&E? What are the sort of situations that we take to the A&E? Because unfortunately for me, I've had to be to the A&E a couple of times this week, and it looks like my issue is not being addressed. So my question is, am I at the right place? What is it that I'm supposed to do to eventually escalate the situation when you probably think it is an emergency? Because some of the times we know ourselves, we know what's going on with us, and sometimes it feels like the healthcare professional you are talking to is not probably seeing the urgency or is not acting upon it. So how do we go about that?
Okay, thank you very much. Yes, so for accident and emergency, it's exactly what its name implies. It's for accidents and emergencies. So what we are talking about is there is a road traffic accident, someone's arm is slashed, you have a chest pain that is like a heart attack, you have a abdominal pain that is searing, not something that I've had for like 1 month, but sudden abdominal pain that is searing, that I cannot live with this. Very, very, very bad. Sometimes things like stroke. I can't move my hand right now. It's happening now. Things like I'm bleeding profusely. I can't stop it. I've put something to hold it. It's not stopping. It's going out of me right now. I'm dying. I need to be somewhere right now. So those are the things that are addressed or rather that should be addressed in A&E. So I have a headache. Not I've had it for 3-5 days. I have a headache that is bang on. Oh, that's A&E. So things that I don't feel I'm quite right. I feel that this is a bit somehow. Yes, that should go through the GP. That should go through the GP. And when that goes through the GP, it is such as, okay, everybody gets frustrated about GPs. We are always in the news. Everybody's always say, "Oh, GPs are just useless" and all that. We are so used to it, and now it's now like a song. When I am on the phone, GPs I say it to you. I say it to the patient. Oh yeah, GP, are useless. Blah, 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 blah. Okay, so the point is that for GPs is to less urgent things, and then we can investigate it. And if the investigation does not prove anything, we escalate it by referring you to specialists in outpatients, because they are not going to address it in the A&E, because that's not what A&E is designed for.
Right.
Okay.
Yeah. Okay. I think we have a question. Thank you for that anyway.
Thank you.
So don't know who the person is, just says Nokia 6.2. Thank you very much for those vital information. Are there any dental services that is free, or dental services, or all dental services have to be paid in the UK?
Yes. Funny enough, I'm not really sure why dental service have been secluded. There must be a dental policy about it, which I'm not sure. But yes, all dental services are to be paid for. I think it's they have 3 tiers, about 26 pounds 40 or something for emergency dental. But for operations and all that, it can go up to 200, 300 pounds. So it's quite expensive. However, maybe women, when you are pregnant, you actually have it for free. So I know a lot of people that they wait till they are pregnant, then go for teeth whitening and all that. But for some reasons, when you are pregnant, you have it for free. But I think there are also some concessions. Some people who are on benefits and all that also have it for free. But yes, all in principle, all dental services are paid for out of pocket. It might not be that expensive most times, unless it's a lot of works. But yeah, it's paid for. Dentist, yes.
Okay, thank you very much for that. So we have a comment that says, thank you for the information, very helpful and informative, because health is wealth. That's indeed, because obviously if you don't have a good health, you cannot work towards bringing together some wealth. Are there any more questions?
Yes, please.
Yeah.
Hello.
Yeah, please go ahead.
Yes. Good morning, everybody.
Good
As in
morning.
California here. Good morning.
Good morning.
Doctor. God bless you all.
Thank you.
Thank you for this lecture. Very educative, informative, and very needful. Well, I just want to ask about when you are saying something about bowel cancer screening feeds. Can you relate it to enteroscopy or something like that? The
Okay.
screening of the bowel, is it
Yes.
part of the needful investigation?
Okay. Thank you very much. Yes, so enteroscopy, people call it different names, and I understand what you're saying. So it's actually colonoscopy is actually the most common name, and there is also proctoscopy and there's sigmoidoscopy. So everything all goes in hand. So yes, scope means that you look into it. So fit test, which is the screening that is done, is just a sample of your poo. So that is the screening. So you want to screen a whole 80 million people. You can't actually be putting camera into everybody's back passage and be looking at 80 million. It's not feasible. So that is why there's a screening, which is the stool test, which is the fit test. It's just a stool test. You put a stool into a sample and post it in the mail. And then if there's any sign of blood, it means it's positive. If it is negative, we don't do anything about it because that one does not have bowel cancer. But if it now comes back as positive, that the screening test is positive, we'll now invite them for a enteroscope. So enteroscope is diagnostic, to diagnose it, but the fit test is to screen. So people that don't have any symptom, we just say because you are 50, we want to check. It's just for screening. But when we now see that the person has a symptom, for example, the fit test is positive, or they have symptoms like they have blood coming out of their back passage, they are losing weight and everything, then we go for a enteroscope.
Okay, thank you.
Thank you. We have another question. It says, what about optical services in the UK? Maybe eye screener and recommendations of glasses are similar. So the person wants to know if optical services are on the patient's cost or the NHS takes that as well.
Okay, so there are two questions there. There's eye screener and optical services. So there is, as I said, diabetic eye screening is free. So that is that. You understand? So diabetic eye screening is free. However, optical service, I just want to go and do my optician test, is only free for children. I think I think it's up to age 18 or so. But generally, in principle, it's not free. It's free for some people on benefits and some other people that are classified as under social service and all those kind of things. But in principle, it's not free. So you're going to optician, Specsavers are the ones that do it, and I think Asda, you have Asda opticians, so they are all private. You get what I'm saying? And so you need to go and check with them and actually book and pay for those services. But if it's just a screening, And a caveat to that is if you have a acute eye pain, you can go into the A&E. There is always a eye casualty, and that is free of charge. So acute eye pain, my eyes is red short and it's painful right now. You have to go to eye casualty and you are seen free of charge. But I just want the glasses and all that. That is paid for. It's paid for service.
Private. Okay, thank you so much for that. There's another question which says, can you tell us if prostate cancer is prostate cancer screening is invasive?
Okay, yeah. Thank you for that question. It depends on what you call invasive. So prostate cancer screening, they found out that it's not as effective as the other screening, and that is why it's not put on a national thing, and it's only on a ask for basis. So you just go to your GP and say, I'm already 45, I'm already 50, I feel I want to have a prostate screening. Ideally, it is 2 steps. Number 1 is that I invite you into the office and I do a digital rectal examination. What that means is that I put my fingers up your back passage and feel for your prostate, because the prostate is just on the water pipe. I should pass urine. The prostate is an organ just there. So I examine it by putting my hand into your bum, if I use that word, and then feel for it, so I can know if there's a problem there. Then we also do a blood test, which is called the PSA. So it's just a blood test. So blood test is not invasive, because it depends on what you mean by this. Some people feel that that's invasive. And then the other one is just putting your fingers and feeling. So it's not really invasive. However, if the PSA comes back positive, that's the screening. Screening is different from diagnosis. Now, if the PSA comes back positive, that is, comes back raised, then I will refer you to the urologist who will do something invasive, which is putting a scope into the prostate and taking a slice or a piece out of it to check under the microscope. So the diagnosis is invasive, the screening is not.
Okay, yeah, that's an interesting one. Thank you. And then another question for you. Would you recommend us to have a private medical insurance, or what's your view on it?
Okay, so I'll take this. My position. If you have enough money, and you just want to I can't just be waiting for NHS. They are too slow for my liking. Yes, do take a private insurance. Many people will say, I want to be seen by a specialist tomorrow. I'll say, look, you can't be seen by a specialist tomorrow. It's not possible. You will be seen by a specialist in 3 weeks' time if you are very lucky, or 6 weeks' time. You get what I'm saying? And because I do not think that you actually need to be seen earlier. The only things we make people see earlier in this country as GPs, the only thing we make people see earlier is cancers. If we think it's a cancer, you must be seen in 2 weeks. It is recommended, and if you don't meet that target, the government penalizes us. So if we think it's a cancer, you must be seen in 2 weeks. If it's not a cancer, you can wait 3 weeks. You can wait 3 months. So if you are of those kind of people that says, nah, I can't just be waiting. If I want this mole removed tomorrow, I want it, then take a private insurance, especially if you can afford it. The cost of a private insurance is about, for a family or maybe of 2, without much sick, if you don't have a lot of health problems, is going to be ranging between 70 to 80 pounds per month. So if one can actually afford it, why not? It means that no matter what happens to me, if I just feel that I probably need something, I can get it tomorrow. So I would say yes, if you can afford it. If you can't afford it, it's no point, because you would be seen It's not just in your time. So if you like calling the shots, take a private insurance.
Okay, so thank you for that. So for those who can afford to obviously pay for a private medical insurance, our GP is saying if you can afford it, why not? But if not, I think most of the time people feel like the way they perceive their urgency is not the same way that it is being perceived by the GP.
Yes.
So probably that's the reason why people may be a bit cautious and have a bit of mistrust towards the NHS because they may feel like this is an urgency for me, but you're telling me to come back in 6 weeks' time. What if I'm dead in 6 weeks' time?
Yeah, and the truth is because, as I said, I did not say that the NHS is the best healthcare system. I said it is one of the most efficient health systems in the world, and it is true because the cost per patient that we spend on our citizens is about 6,000, I think about 4,000 pounds per patient across, per citizen. Yes, and per resident. In America, they spend almost 12,000 pounds per citizen. That is the comparison. So the point is that, and they don't have as much, coverage of health system as much as the UK. In fact, most of them, as I said, my friend American, if he has a fracture, he won't go to the hospital, never. Do you get what I'm saying? Because they can't afford it. So this is efficient. So we GPs are to effectively use the resources which are finite.
Yeah.
You're not paying out of pocket. So we must make sure that all the right services are going to life-threatening things as much as possible, and all the other things will still be done, but it has to be done as it should be, prioritized.
Yeah. So I guess having sessions like this is really important because we have the opportunity to actually discuss how things are in the field from somebody who is actively in the field, and to also reassure us that the GPs are actually aware of what they are doing. And obviously, if something is life-threatening, they would be the first to signal it for us to get the medical assistance that we need. Thank you so much for that. Are there any more questions, please, about our health, about the NHS, about our medical records in the UK? Does anyone else have questions?
I have a question, actually.
Yeah, please go on, Byron.
Can you hear me?
Yes.
Okay. So I did a couple of tests, and then my GP came back telling me I'm pre-diabetic. I disagree.
Okay.
I disagree with it because I don't think I am. But then when the presentation was going on, I realized that there are some things that we ignore that could actually help us identify things earlier so that we can prevent them from happening. And of course, lifestyle and all that. And I'm sure that a lot of people who have joined this have a lot to learn about lifestyle and how it affects the way our health is affected. So how do you think for us, because you mentioned it, that when we come into this environment, we come with a focus of that making things better for ourselves, for our children, and all that. And sometimes we lose the focus of our health.
Yep.
So how do we create that balance of we?
Okay.
getting to solve our problems that we want to solve, but then ignoring the fact that the health is the basis of which we can solve our problems.
Okay.
As we are running from Africa.
Okay. Thank you very much. Thank you very much for that question. You started off by saying that you were found to be pre-diabetic and you don't believe it. So, you know, I when I was talking in my slides, I put a slide up about the barriers to health. And I said that there are several: location, affordability, acceptability, availability of resources, and then I said attitudes. So the NHS has helped us to overcome 4 of those barriers, and the last one is what? Attitude. So the reason, and one of the things that are attitudinal about us, about we Africans, is that when we have a particular symptom, we tend to always say, God forbid, I don't have it. So it's attitudinal. Now, if in Nigeria or in any other country, they will not even tell you are pre-diabetic. It is until the person loses his leg or the person loses his eyes, that is when they will actually find out that they are diabetic. Now, in this case, they want to do the reverse. So they are even finding out before you are diabetic. So pre-diabetes means that you are not diabetic. We are only telling you that you might be diabetic. So we are telling you before. So this is even a step further. Before you are diabetic, that's before complication, we are telling you that you might be diabetic so that you can actually make those changes, which you have actually said, sir. And that now takes us going forward. How can we balance everything? I will still say it is the attitude in terms of cooperating with the health services about your health check, your screenings, making sure that you take responsibility that I have made sure that I have done all my screenings, I have done all my health checks, and also keeping attention to lifestyle. Am I exercising? Am I eating well? Am I having time to relax and enjoy my own self? So those 3 things, but so the NHS can do all the other 3 barriers, but our attitude, we have to change it ourselves. There's no way, there's no pill, there's no medication to change attitude. Attitude has to be a constant reminder of oneself that, okay, I need to do all these things. I need to actually do them. I don't think there's any pill for it. So not neglecting symptoms, not saying that God forbid, not saying that I have faith to move mountains. Yes, you have faith to move mountains. I'm a Christian and I profess Christianity, but not just neglecting blindly that I have faith to move mountains when the mountains are in front of us, but actually looking at the mountains, having the faith that the mountains will disappear, but making sure you are navigating yourself well so you avoid the mountains.
Okay. Yeah, thank you. Thank you so much. There's another question that is, if you can tell us what happens if a foreign visitor needs an urgent medical attention.
Okay. Yes, that's fine. If a foreign visitor needs urgent attention, go to A&E. So there are 2 ways you can do it. Number 1, you can call 111. 111. You can get access to talk to a doctor free of charge, and also A&E. So as I said in my presentation, if you are a visiting person, you have access to emergency service. In fact, if there's a surgery that is done in emergency, it is free of charge. However, if it's planned, you will be hit with a lot of money. I'm talking about money going up to £20,000. For example, let me give you a quick breakdown. How much do you think an ambulance, people that just call ambulance, how much do you think it costs the NHS? It,
That's an interesting one.
it costs the NHS £650 for one ambulance to just go out. How much does it cost to stay in the hospital one night? Each patient staying a night in A&E. You know how much it costs? Each bed overnight costs £450 to £500 per night. That's what the NHS pays the hospital and all that. So the point is that if you have those kind of things, then you'll be hit with a lot of money. Talking personally, I had family members that had to use the NHS, and I was charged almost £30,000 or more for their bill, and I'm a GP, so don't try it.
So that's if the person is not resident in the UK. So supposing
Yes,
you have somebody who come over to visit you from
to
Africa,
visit you.
they fall
Yes,
sick, they would
exactly.
have to pay for
You have
the
to pay. But if it's A&E, it's accident and emergency, you went in as an emergency, they did an operation, they did IT, no matter what they do, is free.
Okay.
Unless, of course, you are planned outpatient or you now have to stay overnight.
Okay, thank you so much. We have another question. The question is saying, well, this person works in the childcare sector, and they would want to know what are the initial assessments done by a GP when there is a suspect of a child having autistic spectrum or having some special needs.
Okay, thank you very much for that question. That is a very, very tricky area. There is not enough services for the mental health and it's not mental health, this is neurodevelopmental sector. It's a big challenge to both carers, school, and also GPs. Now, when someone is suspected of autism, let me take you through the timeline. So it is probably the family that first started noticing that the way this child is doing it's not normal. It's not normal. Why is the child doing like this? And they start becoming anxious. What is going on? What is going on? And that way they can see it is when they start school, and then teachers notice that this person is not behaving as his age group. Now, this is how it does. When there's a suspicion, what we do is that we refer them to a people called CAMS, which is a Child Assessment for Mental Health. CAMS. We refer them to that. Now, on a good day, there's a 2-year waiting list.
Wow.
Yes, on a good day, there's a 2-year waiting list for that. So that brings frustration for both the parents, for the school, and also the GP. Why is it the GP? Because you come to me every day and ask me the same question, and I'll say, oh my God, there's nothing I can do, I'm sorry. So the point is that it is a very, so you say having some, what are the initial assessments? So the initial assessments done is number one, they are actually assessed by the school. The parents also assesses. What I normally tell them to do is to write a detailed report on what are the things that they notice, and also get from the nursery or from the school a own detailed report of what they notice. We'll put these reports together, and then we send it off to the to the CAMS for them to be assessed. Now, when they are assessed, they will just be assessed and say, yes, they have autistic spectrum disorder. You'll say, so what can we do about that? What can we do about that? To be honest, most times there's nothing much, but there's support. You have support for speech and language, you have support for this, and all this support actually comes very, very in trickling amounts, because the services are not well developed. That's one of mental health and CAMS are one of the services that I feel in the UK have not been developed as much. So yes, it's frustrating and it's not really easy. But yes, it's about 2 years waiting list.
Okay, that's interesting. So that we know. There's 2-in-1 question for you as well. So the question says, what are some of the challenges you've faced in the NHS since you came from Africa? We hear certain patients refuse to be seen by Black doctors and recommend Caucasian ones. Is that true? And how difficult is it to set up a GP practice in the UK?
Okay, thank you very much for that. Thank you very much for that question. Before I go ahead to answer the question, I also want to tell you something that I have noticed. It is true that there is racism. I agree with it. But also, I have a different idea about it, which is something we call xenophobia, or not really. I don't think it's out there racism most of the times. I think it's just that they are not used to you. The cultures are different. Even coming back in Nigeria, I will take it back. So back in Nigeria, even someone coming from the east, which we call Igbo in Nigeria, if they come to the west, the amount of resistance that they receive is massive because we just feel that they are not from this place. Even within, I come from a tribe called Yoruba. Even within Yoruba, my dad was a professor in one of the university. Before he became a professor in the university, he is a Yoruba in a Yoruba city. Because he did not come from that town, there was always oppositions and saying, no, we don't want you. So now I want to bring that mentality, because we are used to that mentality. I want to bring it back into the UK. And it is still the same projection. I think they are even more welcoming, to be honest. I think they are more welcoming than back home. If I move to the northern part of the country, I will be treated worse than how I think I have been treated here in the UK. So to answer the question, I think that yes, there have been some one or two this thing like, oh no, you must not see me. I don't want him to see me because he's black, or I do not understand his accent. I don't understand his accent. But to be honest, it is something that personally I give a very wide space not to make it. It doesn't get to me because I realize from my own background that if there was an Igbo person, in fact, there's an adage back in Nigeria. There's some Fulani people who rear cattle. We call them Bororo. Some people say that they were reading a news one day and they said that 3 people and 2 Bororos died. 3 people and 2 Bororos. So some people don't consider them as human beings. So because I come from that background, I can think about it. I don't think what I have experienced in the UK is as bad as what you would even experience in your own grounding. So there are discriminations, but it has not gotten to me so much because I know where I'm coming from. And how difficult is it to set up a GP practice in the UK? Can we set up one? Of course, you can do anything you like. But yes, one can set up a GP practice. I don't know whether the person is a GP himself or is someone that is a manager. But the point is that there are a lot of bottleneck policies to set up a GP practice. It is not a straightforward thing. It has a lot of compliance, just like any other thing. For example, some people say, "Can I set up a what's the name, residential home or a nursing home?" Yes, you can, but there are a lot of bottlenecks. I have not gone much into how to set up a GP practice, but my answer to that question is it is possible to set it up, but it will take a lot of partnership. You can't set it up on your own. It's if you are not a GP can set just an office, but to get planning commission, to get all that, it is a big deal that needs a lot of multi-sectoral collaboration.
Okay. Thank you. So there's another question that says, for pregnant women who stop their jobs after childcare, after giving birth, are there any government benefits for them if they can combine working with the newborn?
Of course, yes. of course, there is a lot of resources for pregnant women and also even after pregnancy. So there are different caveats for that. So number one, if you were working before, I think if you have worked for in that position for up to I think 6 months, you are eligible for maternity pay. So you are being paid, I think for the first 3 months or something like that, you are being paid your full salary. Then I think by the 6 months, it drops down to about 50% or 75%. I'm not too sure. And then they continue to pay. Now, for pregnant people themselves, if you are not on a visa that says categorically no access to public fund, then you are able to claim some benefits. They will pay you what's the name? They'll pay you per month for every day. I think it's up to 500 pounds. I don't really know this. But your household income should not be more than 50,000 pounds. Yeah, I think 50,000 pounds. If it's more than that, then the access is reduced. You get what I'm saying? You can have access to this very easily on the gov.uk site. I'm not too good on the policies. I've never used it before. So if you just go on the gov.uk site, just say pregnancy pay, pregnancy pay .gov.uk, you will get it there. There's a start and gives you an assessment of yourself, and you will know whether you're accessible and what you should do next. It's quite easy.
Okay, there's another one. A lot of Black people were skeptical of the COVID-19 jab because of the history of misuse of medical technology in America and in Asia. From a purely clinical point of view, do you think there is any reasons why we should be skeptical? COVID jab.
Yeah, thank you very much. There are always reasons to be skeptical. There are always reasons to be skeptical. There are always a lot of what's the name? What do you call it? Theories, conspiracy theories. There are a lot of conspiracy theories that they are trying to use it to eradicate Black people. I don't know why they will be doing that when they're also giving white people. But the point is that the point is that no matter what, how many there has been so many misconceptions over the years. For example, even during the Spanish flu, 100 years ago, there were always conspiracy theories. You get what I'm saying? Every technological advancement has been met with conspiracy theories. But in terms of whether it's effective or not, in our data, we have found out that it is effective. I don't think that Black people should be skeptical about it. I think they should go ahead and have the jabs. The jabs have actually reduced the severity and the morbidity and the mortality of COVID, as we can clearly see by all data. You get what I'm saying? The ones that are somehow is, for example, in Nigeria, I do not think that COVID has actually killed so many people as much as it did in the West. You get what I'm saying? So there is a very important reason why we should give everybody COVID jab in the UK. But I do not know whether that's the same thing that is in Nigeria, because in terms of public health need, I'm not sure how much it has affected Africa. Do you get what I'm saying? So it's on that basis. But if it is blacks in the UK actually died more of COVID. So I feel that everybody should be encouraged to have their COVID vaccination, because it has actually helped mortality and also morbidity of COVID. So in the UK, yes, I agree. In Nigeria, I do not know why we will now do mass vaccination, because the effect or the outcome of COVID on the country wasn't that significant. There are many other things, malaria, cholera, or even poverty. If there's a vaccine for poverty, I think that's better.
Indeed, that would be clearly possible for Africa. Right, thank you so much. We're just going to take the last question, and that's if you could recommend a website on antenatal apart from the NHS website?
On antenatal, so that is quite, I'm not really sure what that means, but I'll recommend a website called www.patients.uk.co.uk. Yeah, .co.uk. Patients.co.uk. It's a
Patient.
very good website for almost everything. And yes, I can recommend that website. I'm not really sure what the person wants about antenatal because the antenatal system in the UK is second to none. It is wonderful. And you would know that I'm a enthusiast of the NHS. I know the work that goes into it, and I can say that the antenatal service in the UK is second to none, and it's very, very good. So you will always have so much resources from your midwife up to the end. It is wonderful.
Okay, thank you so much. I'll just pick this last question. So, would you advise us taking the third COVID vaccine jab?
That's a booster
The
dose.
booster, yeah, the booster.
As a GP, as a doctor, I can only talk from evidence based. You get what I'm saying? I can only talk from evidence based. So everybody will have their own personal opinions. You get what I'm saying? So my personal opinions really does not really affect the evidence base. So the evidence base is that it's important that people who are at risk or are vulnerable should have the booster jab. However, if you're not vulnerable, to be honest, that is a choice. In fact, the vaccine in the first place is a choice because the booster dose is targeted to the vulnerable, healthcare practitioners and the vulnerable. What do you mean by vulnerable? People who have existing chronic medical problems like heart disease, stroke, diabetes, severe asthma, not any asthma, severe asthma, and all that. So I would recommend that people that are vulnerable should have the third booster dose. It's very important because if you come down with it, you'll be unwell. However, the general population, it's probably a matter of choice after you've had your 2 vaccines. You probably don't need it, but if you have the opportunity to, why not? You can decide to. But if you are vulnerable, I think it's going to be a good idea to take it.
Thank you so much, Dr. Olutosin, for joining us today. I've learned so much. It's been really, really insightful. Thank you for sharing this valuable information with us, and hopefully we can also take it home and use it for the benefit of our health and that of our loved ones. At this point, we've come close to the end of today's event. Before closing down, I'll just invite one of the trustees of Settlement Support CIC, Mr. Kofi Folsom, to just give us the closing.
Thank you, Annabelle. It's been a wonderful time. The session has been excellent. Dr. Olutosin Awoyemi, we want to thank you so much from Settlement Support. I believe that there were so much questions and the information that was coming was really, really useful. I've benefited a lot, and we just want to express our sincere thanks from the whole leadership and the board of Settlement Support. This has been a wonderful session. We look forward to having other sessions with you. I think today has been really good. So thank you so much for the information that you brought today. We just want to encourage everyone. You can post your comments in the chat boxes if you want to express your thanks. And we want to gather some comments for our website. So if you've attended a particular session and you've benefited from it, you can put your comments. We like to kind of put some of them on our website to get just feedback as to what we're doing in the community. Thank you so much for everyone.
Thank you very much for having me.
Thank you. So God bless you, everyone, and look forward to an invite. If you can leave your email, please do so. We will be reaching out to you with our subsequent workshops. and everything that we'll be doing from settlement support. So thank you. Over to you, Annabelle. Bye.
Thank you. Bye. Thank you.
Thank you.